Good afternoon, I'm Mabel Jung, and you're watching continuing coverage of the World Healthcare Congress here in Washington, D.C. And in the studio, I have Dr. Jeremy Corbett, who is Chief Health Officer of Nurtur Health. How you doing?
I'm doing well, thanks for having me.
Great to see you.
Likewise.
Well, let's talk first about what Nurtur Health is. You're a behavior change company?
Nurtur prides itself on being a behavior change company, and what that means is we move patients from one state of health today to a better state of health tomorrow through behavioral change models.
Okay, give me an example of some behaviors you're trying to change.
Sure, so a member is overweight today with diabetes. They know they're overweight, they know they're diabetic, but they don't have the education or the resources or maybe the social support to get rid of that weight or to manage their diabetes effectively. What Nurtur would do would be to step into the gap, to hold their hand, so to speak, and pull them towards better health.
Okay, so like smoking cessation programs or something like that?
Exactly.
Okay. Are the programs that you have unique to what you're doing, or are they unique in any market? Like perhaps it's very difficult to implement these by yourself, so they come to you?
Sure, so we certainly have competitors in the marketplace, and we'd like to say we are unique, and I believe we are, primarily because of the way we do things. Disease management or wellness management isn't unique. Everybody has it. Every employer has it. Every insurance company has a disease management or a health and wellness arm. What Nurtur brings to the table is a really unique skill set in terms of personnel. Our coaches, we call them coaches, are very uniquely situated and very uniquely trained to do what they do in a different way. And we call it a people care model. So let's go back to the overweight diabetic. We might have a dietitian work with this person on their weight and exercise or diabetes diet plan. And we find out during the course of that conversation over a series of months, they now have COPD. We have the ability to call a specialty health coach, a respiratory therapist, to jump on board and help out with the same member in a way that a singular coach would have difficulty doing. Their expertise may be dietary concerns, but now they've got a respiratory therapist to help out with the respiratory concerns. And that people care model really gives us an all-encompassing, kind of holistic approach to care that we think drives spend down and leads to better health outcomes.
What are some of the challenges you face, some of the barriers?
Honestly, I'm finding every day that the barriers are different based on the population. So Nurtur's both uniquely situated as well as blessed to work in the employer space. Roughly half of our business is outside of the Medicaid managed care space and half is within the Medicaid population. So the answer is it's different. For a Medicaid mom with 2 or 3 kids, those barriers might be transportation to the pharmacy. It might be access to a good primary care physician. It might be child care issues. Talking to an employee for Dell Computers, it may be honestly shame with his weight. It may be access to a gym that's closer to his home than the restaurant that he usually goes to. And so the barriers are different, but they're just barriers. And our goal as coaches, our goal as Nurtur, is to essentially hold the hand of that member and help them walk over or around or sometimes through that barrier.
So let's get back to the mom,
Sure.
for instance. If she's got transportation issues or something like that, how does Nurtur step in?
So if we're on the Medicaid side, we oftentimes will partner with our health plans. So there's an incredible amount of opportunity for help if you know where to go. And so in a situation like that, our disease manager working on diabetes or COPD or asthma might involve a case manager through an integrative model and say, hey, case manager, we need help with transportation. This isn't a disease-specific issue. This is a social or a financial or an economic issue. Can we together get on the same page to make sure this mom gets the care she needs, which may not actually be health related today, it may just be transportation related.
And it will somehow come together and we'll
Sure.
get that mom to where she needs to go?
Sure, yeah, I like to think that it's pixie dust or magic, but yes, somehow it comes together working with this mom in this situation to ensure that she has the ride and that the prescription is there at the pharmacy, and then the disease manager will jump back in to make sure that once she has the pharmacy prescription, she takes it.
Right,
she takes the medicine,
sure.
and that it's leading to better diabetes measures, better glucose measures, etc.
Okay. What's the science behind changing behaviors? I mean, that's a question that has fixated many people on trying to do this better.
No, you're exactly right. I mean, I'm working on it with my 6-year-old, right? I'm trying to change his behavior in his room to get him to clean his room up. There is a ton of science. I think it's a burgeoning field, but not a new field. So there are folks out of Washington University, Duke University, doing some incredible behavioral change or behavioral economics research that is really fascinating and which we think will really change the way we manage members into the future. And it's not all health related. Why do people pay their mortgage sometimes and why do they not pay it other times? Why do they buy a blue shirt, not a red shirt? Why do they buy this type of car or this type of truck? We think the behavioral change component in health is where real lasting change is going to happen, and that's where we're most excited. But behavioral change isn't just a health component, or doesn't just have a health component. It plays into everything we do in life.
Sure, sure. What are the long-term implications of trying to get someone to take their medication, for instance? If it's as simple as that, as not taking your pills at the appointed time, there are long-term benefits to getting this done right.
Yeah, absolutely. Mabel, that's a great question. I think of health as a series of gates. You've got to have access to a primary care physician to really engage you and be your healthcare quarterback. That might be gate 1. Gate 2 might be getting the right prescriptions. Not a prescription, but the right prescription. Gate 9 might be taking the medications in an ongoing fashion, what we call compliance. The long-term effects of that ultimately will be the allowance for more people to be in a pot or in a pool than ever before, with less dollars being spent than ever before. You know where healthcare is going. We don't have more money being put into the system. Those strings are getting pinched. That bag is getting tighter, but yet more and more members are in that bag than ever before. And we believe through disease management, through health and wellness, we can actually save money long term. And you hit the nail on the head. It's not a tomorrow answer, it's a long-term answer. But we think probably the biggest bang and the biggest effect from good management is ultimately long-term savings for more people, better health.
Yeah. And what's the takeaway you want people to really have about Nurtur Health at this conference?
I want people to know that Nurtur is at the cutting edge, the bleeding edge of behavior change science, that we are engaging members in a way that's never been done before. We are not a telephonic company calling people at 2 in the afternoon. We are a multimodal company affecting people where they are currently to move them to a place tomorrow that's better than even they ever imagined.
Okay, Dr. Jeremy Corbett, thank you so much for today.
Thank you.
And I'm Mabel Jong. Thanks for watching.